Well, hello and welcome to our show today. I'm Barbara Kovacs, Director of the York City Health Bureau, and I'm going to be one of the moderators of today's show. I have with me Monica Kruger, who is our Personal Health Services Supervisor, and also two experts on the field of immunization, Dr. Matthew Howie, who is our Medical Director, and Dr. Almira Contractor, who is a pediatrician at WellSpan's York Hospital Community Health Center. And they're going to talk to us today about immunizations, why they're important, maybe dispel some myths that people talk about with immunizations, and just to answer other questions that we have about immunizations that you might be interested in. So welcome, Dr. Howie, Dr. Contractor.
Thank you.
And we'll get started with some questions. Over the course of the year, we celebrate a lot of national observances related to health, and a lot of them are immunization observances. August happens to be National Immunization Awareness Month, so can you tell me a little bit about what that means?
It's part of an initiative from the CDC to highlight the importance of vaccines and their role in preventing poor health outcomes and disease that historically have caused a lot of problems in the community.
It works as a public health initiative because with having a month that's dedicated to immunizations and such, we're able to promote more education of the community, because it's not just about, the providers and what we do in the office. It's more educating the community about why we do the things that we do to help with public health. So protecting the children, and as well as, older folks that take care of children. So,
can you tell us a little bit about, excuse me, can you tell us a little bit about how immunizations really work?
So immunizations, the concept of immunizations have been around for a long time. I mean, initial immunizations for smallpox were taking a little bit of the smallpox bacteria and actually inoculating it or putting that into another person through the skin to promote an immune response. The idea behind that came from actually milkmaids because there was a condition called cowpox, and milkmaids often were exposed to this. And then when smallpox occurred in those regions, the milkmaids sure didn't get sick because they had previously been exposed to it. So the idea of taking something that hopefully is less serious and less damaging and protecting an individual by that exposure in a very controlled manner. Now we've come a long way since then in terms of how we do those vaccines. We're taking either what are called live attenuated viruses, which is very weakened viruses, or just killed viruses that are selected, and using that or parts of those individual items to promote an immune response in your body in a planned manner, so that in the future, if you are exposed to that bacteria or virus, you're going to be protected.
And the way the body would work is that once it's seen this sort of a killed virus or live attenuated type virus, then once it's seen it, it has some memory that it develops toward fighting against it. So when it encounters it for, in real life situations, it'll have a quicker response and it will fight immediately, as opposed to waiting to develop the response and then providing the immune response. And by then the person has already become ill. So it's like, if you picture like a small child who may touch something hot and then remember that it's hot, and they are able to draw away, but that first time it might take them a little bit longer to draw away from something hot, like hot water, but they'll remember it. So next time they get close to something and it feels warm, it'll be a quicker response. So same way with vaccines, it's just a much more brisk response, so that you don't get actually ill from the illness, but you have a chance to build up the immunity and fight it off before it actually attacks the body.
So what happens when individuals choose not to immunize themselves or their children?
Initially, very little occurs because we're almost a victim of our own success with vaccines. We don't see widespread epidemics of polio or measles or mumps the way we used to because of the effectiveness of vaccines. So when a small group opts out of vaccines, we don't see an initial bad outcome or outbreak from that until an exposure occurs. An example of this would be what happened in California earlier, actually last year it occurred, was the outbreak of measles associated with Disneyland. And this was a group of individuals who were exposed to someone who had measles who was unimmunized from another country. And then with that low level of immunization in that community, that exposure then generated an infection that spread very rapidly. Measles is a very infectious agent, and so we were right to have a significant amount of concern about that exposure. But initially, there's no quick consequence, but when it does occur, it's quite impressive and quite dangerous.
And it's important, like when people remember, when they opt out of vaccines, they may be opting out because we are all protected by something called herd immunity. So when you vaccinate a majority of people, you protect those within it, you know, kind of in a cocoon way. The thing is that we vaccinate everyone so that we can cocoon the people who can't get vaccinated or who don't have a good response to the vaccination. So infants who may be too young for vaccines, folks who can't get it because they're allergic, or people who don't have a response to it for whatever reason, their immune system doesn't have a response. So that's how we protect the folks that can't get a vaccine. If you choose not to get a vaccine, you're decreasing. So you're basically decreasing the amount of immunity that's in your group. So as a citizen in a community, to protect the community, if you get your vaccine, then you help to protect the folks that can't get it. If you don't, then as the vaccines in the community drop below a certain level. So for certain vaccines, it's just below 90% of the community. In certain vaccines, it might be up to 70%. But once you drop below that level, more are exposed, and then you have basically a setup for like a small epidemic in that community. When you choose not to vaccinate, not only do you put your own child at risk, but you're putting other people at risk, because if your child gets the disease and doesn't get that sick from it, and lots of people will say, so what? I had the chicken pox. Right. But you may get it, but you may not know that your neighbor's child was recently on chemotherapy, and if they get chicken pox, they could die. So, it's really not the right thing to do, because you're really trying to protect your community. And in this day and age, when travel is so, just so rampant, we travel because we can, because we don't have to worry about getting ill, and there's a lot of access to different parts of the world. And a lot of the folks who may choose not to vaccinate, they may be ones that go over and do good things in other communities, such as, in mission trips or help building schools and things, but they may bring the illness back. And even if they don't get sick, they're bringing it back to their community who gets sick. So sometimes it's great, that, you feel like you're doing a good job, you're being as natural as you can, but actually it can run a huge risk that goes outside of your own family. So it is a big consequence. There's cost, there's illness, there can be death occurring, so it becomes everyone's problem then.
And it's a generational issue. I mean, we're a little bit of a victim of our own success. Mm-hmm. When you do a really good job, people forget what it's like to have measles epidemics, polio epidemics. I take care of adult patients as well as pediatric patients, and I have two patients that I care for that are post-polio syndrome patients. One was foreign-born, had polio when living in a foreign country, and the other one is just an elder who had it when she was younger, and then has now, you would think she would have had a stroke because she has weakness on one side of her body, but it was affected by polio, and she's been wheelchair-bound her whole life. So those memories, they fade with time. And then when those memories fade, people forget how devastating these diseases can be until they rear their head again. And then it becomes a very big importance, and it takes a coordinated response, and sometimes people are harmed in the process. Yeah,
people used to lose several children. Like if they had 8 children, they would just assume they may lose 2 or 3 because of an infectious illness against which we can now protect. I mean, in this day and age, if you said, oh, we got this vaccine against HIV, because we see it, people would be very excited about it. And it's not as fashionable to have a vaccine against polio because we don't really see it. But actually, it still exists. And the moment we stop vaccinating, things will return. So, well,
I was just going to make a comment about that it's not always deaths that you see because of the vaccines, but there's also the harmful things that happen. Like I myself was a victim of measles or German measles, I forget which one, and it left me deaf in one ear. So it's those kind of things that also can hurt people.
Even things like
vaccinated.
meningitis can cause, neurologic problems. There's a group called Meningitis Angels, and they have teenagers that talk about having lost limbs and things from that illness, and having known they could have been vaccinated, they would have definitely vaccinated. So.
Yeah, for adult vaccinations for invasive pneumococcal disease, we intensive care doctors who take care of these individuals say, hey, everybody talks about pneumonia vaccine, but really it's for invasive pneumococcal disease. And that bacteria can be a bloodstream infection. It can cause, it can kill, but it also can maim. It could leave people devastated neurologically in terms of how the brain functions, or loss of limbs as a complication of the infection. So it's still a very present infection. Its very name is a little confusing, but it really does wreak havoc when someone gets infected by it.
So with all this talk about the effectiveness of vaccines, how is it that children are able to be exempt from vaccinations? Even in the public schools or private schools or homeschoolers, how does one become exempt from having?
So regulations regarding vaccines typically say you can opt out of vaccines if you have a religious belief that says, I don't accept this as a meaningful intervention based on my religious beliefs, or strongly held beliefs. And it's a tough one for us to grapple with. In our own practice, both Dr. Contractor and myself work with the public in the community health center. And in that process, we have patients who will come and make this statement, hey, it's against my religious beliefs. And typically when you explore that a little bit, it's usually personal beliefs. It's not usually religious beliefs. And we have a decision to make, because we don't have just that patient. We have a group of patients who potentially could be exposed to that patient who's unimmunized in our practice, and they could potentially bring that infection into our practice population. And we've had that discussion. Do we exclude them from our practice because of the risk to other patients versus keeping them as part of our practice? And we've been deliberate in saying, stay in the practice, but they have to accept the fact that even with this this perspective that they have, they're going to have to accept that they have to have that conversation with us each time they come into the office. And it's not disrespect. It's just over time we believe that with trust in that relationship, we're going to be able to, and we've seen this, have people change their mind. Because it's not a religious belief, it's a personal belief. It is one that over time, people that then with increased trust are able to maybe make a different decision.
And with proper education. So that's every time someone comes in, they come in with a different mindset, and they may meet a different person, of us, for example, and we may, mention something that person didn't realize ahead of time, or just had a misconception of something that they thought. So you never know when that education will settle, and then they'll really kind of go with the vaccine. There are folks that are actually exempt because of true reasons, such as, if they're allergic to a component, if they had a significant adverse event associated with the vaccine, like they had a really bad allergic reaction, or if they're immunocompromised. I mean, I have patients who are on certain medications or have certain underlying conditions that they are not able to receive vaccines. If someone had a bone marrow transplant, or on chemotherapy, or someone who has a syndrome that means that their cells are so low that they are counting on others to be vaccinated to protect them, because they themselves will not be able to develop the response to it. So those children are exempt. But with that exemption comes the cost of whether, if there is an infection that occurs in that school, then those exempt children will then have to be either quarantined or outside of school for a certain period of time, during which that illness is actually either going through the community or being contained. So.
And if those children become ill during that time of an outbreak, they are going to struggle a little bit with access to health care. The providers who provide that health care at that time have to have an alternative plan for bringing them into the practice in a way to keep everyone safe. We want to take care of that child, of course, and that's always the priority of the providers, but doing it in a way that doesn't expose other children to that risk. And that means masking the child to prevent spread of the disease, coming through an alternative entry, and being kept in select areas that are felt to be safest.
Yep, we've had to recently do that in our office with measles, and folks who came in with fever and rash who may not have been vaccinated, having to go through different precautions to bring them in so that they don't expose other people.
So interesting. Okay, so there are a lot of vaccines out in the market. So how many infections are we really able to prevent by having proper immunizations in the community?
So with proper vaccination, we have about 25 different infections that have been impacted or controlled based on vaccination, which is a pretty astounding number when you think about it. So 25 is the hard number, but more are being developed now.
And as we develop more, we also develop the ability to combine different vaccines. So I know when parents think about all the, some parents, really do worry about the amount of vaccinations children get, but remind them that there are certain ones that are combined, and actually those combinations are studied then in that combined form. So it's not that we just drew up a few different vaccines and decided to inject it into one, arm or leg. It's that was created to work together for a reason, to minimize the amount of injections, but maximize the amount of protection the child gets.
Okay, earlier this year there was a concern over a whooping cough or pertussis outbreak in York. Can you speak to that and what measures were taken? And
so pertussis is a really common infection. When you take a look at the particular infections that we have vaccines for, they were all done for a reason. They were widespread and they caused significant issues. Whooping cough, no different. So pertussis outbreak at a school in this city occurred. Interestingly, it was at a school that had students that came from different areas of the city and the county. So it kind of crossed those lines that often infections do. As a response, the health department was able to work with the schools and other folks in the community to identify where the infections were, get the children treated appropriately that needed treatment, and also coordinate vaccinations for folks who were unimmunized or who were exposed that needed revaccination for this. They also contacted local primary care providers who were working with other children in those classes to alert them to the symptoms and to hopefully encourage them to be a little more aggressive in terms of treatment. Whooping cough, when you do treat it early, can be shortened in terms of its duration and decreased spread. And just reminding those individuals in the community who don't see it on a regular basis, this is a way of approaching it from a public health standpoint that could be most healthy.
And then we also like to, make sure with pertussis that we're not only just vaccinating the children that are at highest risk for, becoming ill, but making sure that the caregivers are all protected. So you'll notice most of the daycare providers, the pediatricians, the healthcare providers, anyone who's in contact with a child, including grandparents, babysitters, they should all be protected. So that's part of our education when the children are born and they come in. One of the first things that we do say is, did you get your Tdap also, since, grandma, you're going to be in charge of babysitting and such. So.
Yeah. Yeah, and the recommendations even for pregnancy at this point is routine vaccination with Tdap for that to boost that pertussis coverage in an effort to, as you said earlier, cocoon, helping to have those who are caring for the child when the child can't be immunized protected so they can't potentially expose that unimmunized child.
So there has been some skepticism lately regarding immunizations. Can you talk a little bit about what people have heard, what you've heard in your practices from people about them wanting or not wanting immunizations? What are the myths? What's true? What's false?
Well, I guess it depends on who you ask and when you ask. It really is, where do you get your information and who do you trust? And that's part of that conversation we have with families when they have resistance to vaccines, is we try to identify, so where are you getting your information, to try to help understand that. We've been trying to address issues and concerns with autism for many, many years. And some very bad science was done, and pseudoscience, really the absence of science, was done regarding issues with the MMR vaccine and autism. But unfortunately, once those things get out into the public, it's very difficult to stop them from being there. And it's really been very, very well disproven that is not a connection or a link whatsoever. And there are other kind of components to the vaccines that have been called into question.
So, so besides the autism, question that folks have, just kind of to make it very concrete, in 1998, there were 8 children that were studied by a physician in England, and that science was discredited and taken off, from the medical journals, because those were 8 children and it was not concrete science that was used. Since then, multiple studies have been done and so many resources spent toward disproving it, where many feel that if we could use all those resources to find what actually causes autism, that would be so much more productive. Unfortunately, that's what happens once somebody says something, be it a celebrity or someone who just catches something that everyone wants to know why their child has autism. So it's so much easier to have something concrete that you can blame. But actually, people who are exposed, they have had studies that show a mother that may have had German measles in her pregnancy may have an increased risk of autism. So, things that we could prevent could actually help that. So spending your resources in the right way is definitely worthwhile. But the other things that folks often will bring up are that it's not natural, that it's more natural to get the illness and then fight it off. And, to that you can say things like, well, do you really want to get tetanus and then say, yeah, I should have gotten the vaccine? Or, it doesn't really make sense. There are things that you can prevent. And if you could wear a seatbelt to prevent, yourself injuring yourself badly in a car accident, you would wear it. You wouldn't question it. So there are certain things that, it's good to question to get the right information. But on the same note, yes, things are natural, but it doesn't mean that you need to get ill in order to feel better about it. In fact, when you get vaccines, there are certain illnesses such as HPV that you can prevent better if you're vaccinated, because then you're protected against various serotypes, as well as your protection is higher than if you actually had gotten the infection. So that's one, the natural part of it. And there's no way of knowing that your child is going to be the one that gets the mild case of chickenpox as opposed to, the pneumonia, the skin disease, and, horrible things associated with it. The second thing folks worry about are the chemicals, for example, that they think are in the vaccines. Now, one thing that I always tell parents is that vaccines are so purified. They go through years, at least a decade of study before they're made available to the public. And people laugh, but my common comment is, do you even know what's in the cheese curl that you might have given your child, or in the Tylenol? Not that Tylenol is unsafe, but if you sit and you read the ingredients that's inside of any packaged food that you're giving your child, and then compare it to what's in a vaccine, there's really,
tuna fish.
It's a huge, anything packaged, anything that comes in a pre-filled bottle, it's all going to have some kind of chemical in it. It doesn't mean they're all out to harm you, but it means that there's nothing that's going to be, it's not like you're even drinking milk straight from the cow half of the time. So there are just things, I'm not saying suspect everything, but on the same note, in perspective. If you're giving Tylenol and you're giving a vaccine, there's a huge difference. But on the same note, all these things came from a manufacturer. The last thing are the things that they use in the vaccine as a preservative, for example, to keep the vaccine safe. So one of them that has been brought up a lot is aluminum. So aluminum is a natural substance, natural metal. You're going to get aluminum in the air you breathe, in the food you eat. In fact, a baby who gets their vaccines will get, they may get just the amount, they may get 4 milligrams of aluminum, for example, it's not even milligrams, but over the course of 6 months. Whereas in breast milk, they're getting 10 times that much in breast milk over 6 months. They're going to get at least 20 times that much if they're drinking formula, even more if they're getting soy formula. So when you're putting together the perspective, of if you gave a teaspoon of milk of magnesia, you're going to be giving more aluminum in tums than you would get in one vaccine in just a teaspoon or in a tablet. So when you think about the things that people worry about, aluminum, mercury, the amount that you get is so minuscule and in such trace amounts that little trace amount has done so much to preserve a vaccine. But over time, you're not going to build up any kind of amount. They've actually studied how much aluminum a child may build up over the years of getting vaccine, and it's negligible. There's no change. It's going to be the same whether you eat food and you avoid a vaccine or if you eat food and get a vaccine. So you're not going to be immune to a lot of these natural occurring things that are out there. What other thing that people
Well, maybe just think about how we, aluminum cans that we preserve food in, and aluminum cooking supplies. I mean, this has always been a bone of contention when it comes to where we get certain exposures to. But I think that Dr. Contractor is right on. We should just talk. This is a matter of perspective, and when you actually look at quantities and quantify the concerns versus just using the name, it becomes very clear this is not the issue. Although we are looking for answers for things like autism. When you have something that's so pervasive, so destructive to a child's life and development, and you don't have a clear answer, it's natural to look for answers. I don't think anybody questions the importance of looking for the answers, but the answer isn't here. In terms of the cost for it, we need to look elsewhere and use those resources wisely to get there.
Another thing that folks worry about is it too much for a baby's system? Getting all these vaccines all at once. So folks will try to maybe separate out the vaccines. If you really step back and you look at it, when you're in your mom's womb, it's totally sterile. The moment you get out, there is thousands and millions of bacteria and viruses and all kinds of things you're exposed to. I mean, and the way the vaccines are purified now, they're just in the amount of immunogenic components, for example, that used to be in just one smallpox vaccine. It was like 200 immunogenic particles. Now, if you take all 14 of the vaccines that we normally give in early childhood, it's down to 150. And that's in all of those different vaccines. In comparison, if you were to walk into Walmart, open the door, get your baby in the cart, even if you sterilize the cart, have the baby even touch your purse, which has been in various places, play on your phone, they have just encountered millions of immunogenic particles. So if, and there was a physician who actually did a study and said, if you really wanted to test the immunogenic potential of a child after vaccines, we're giving maybe, at any given time, maybe 40 immunogenic components. They could take millions, just multitudes of stuff. I mean, just walking into the doctor's office, they've already hit more than, what you're going to give in even 6 injections. So if you put it in perspective, it really doesn't. It's not overwhelming the baby system. And it's been studied in that way. And so once you start going down a different route of changing, when you're going to give certain vaccines, now you're playing around with science that you haven't done. So up till now, all the studies that are done with certain intervals. They're strict intervals because they're studied in those ways, and it's ideal. The immune response is ideal at those times, at those ages, and in those combinations. So there's a reason for it. It's not just, pick and choose.
So it sounds like education is key in getting people immunized when they're supposed to get the proper immunizations.
Absolutely. So education is key, and just where do you get your information? Where does that education come from? And I think that's the challenge. We have so many more sources for information that we've had forever. Just Google any one of these things, and you'll find lots of people with lots of opinions. But I think you just have to filter it the way you'd filter anything else. Who are you going to listen to? Where are you going to get your information? Who you're going to trust? And our wish clearly is, you go to your medical provider and have that conversation. This is not about strong-arming people. This is about helping people truly understand the risk that is involved, and through that, making a good decision to hopefully help protect that individual and those around that individual as part of the community.
And it is the community. It's your responsibility as a parent or as just a client in the health field. If you go to your doctor, it's good to be informed. And there are so many opportunities. So not only the internet, but you can go to your healthcare provider, you can go to the Department of Health, you can go to different websites. The York and Adams County Immunization Coalition, of which I'm a part, they set up tables of information at, for example, the Women's Expo that's coming up in the first weekend in October, the Baby Expo. There's usually somewhere to get some legitimate information that comes from the right source. And, I tell parents, you wouldn't ask me how to train your dog, but you can ask me about your child, and you can ask me, because that's my specialty. On the same note, you wouldn't get your vaccine info from a celebrity, because that's not their specialty. So you have to remember who you're asking and what information, what background they have to provide that accurate information. So.
You mentioned HPV. We know that's one of the newer vaccines. Can you tell us a little bit about the benefits of that, and is it more for males or females? Can anybody get it? Can you just enlighten us a little bit about that
Yeah,
vaccine?
actually HPV is one of the more, it's going to be the push this upcoming season for the York and Adams County Immunization Coalition. In fact, they have a movie set up partnering with the students, the Student Nurse Association at York College, showing a film and having like a panel discussion about HPV. HPV is recommended for females and males, and we usually start it at 11 years, at that 11-year-old adolescent visit. And when parents ask, why do you give it so early? You know, my children are not even thinking about anything that would get them, you know, HPV that early. It's because that's when they're really strong, they're ready to take the, you know, to develop a good immune response, and you're preparing them. I mean, you don't want to wait till it's too late. It's true, you know, many of them will wait until marriage, for example, but you're not waiting until the exposure occurs. You're trying to build up the immunity before, so you can finish a three-part series. It can be males and females, and even though males are not getting the HPV to prevent cervical cancer, it prevents other sorts of illnesses as well, you know, including genital warts and such. And plus, they may prevent themselves from passing on things that could cause cervical cancer to females. So it makes sense to treat, you know, both boys and girls.
Yeah, initially, the vaccine was indicated for girls, and I think that was a practical measure. Mm-hmm. Early vaccine cost of a vaccine associated with the population who's at greatest risk for the worst consequence made perfect sense. But this is an infection that's passed back and forth between men and women, so it makes no sense to treat one half and not the other half. It's going to be more effective when you go both directions in terms of the treatment. You know, genital warts, other consequences go with this particular type of infection.
And cancers, yeah,
and cancers.
You know, like different cancers that can occur in men and female. So if you think of it as an anti-cancer vaccine, it's just like getting your hepatitis B when you're a newborn.
Absolutely.
I mean, that's, you know, preventative as well. No one questions their hepatitis B, you know, in a baby.
No,
for those that don't know what we're talking about when we say HPV, can you explain a little bit about what HPV, I mean, you've talked about protecting against cancer, but for somebody who doesn't, if this is all foreign lingo, can you kind of maybe explain a little bit more?
Oh, we do that sometimes, don't we? No,
yeah.
Absolutely.
Thanks for clarifying.
Just not sure,
Sure.
you know, if the first time you're hearing it,
right.
people might not understand.
Yeah, but the HPV stands for human papilloma virus, and it's a group of viruses. There's a large number of different types of the virus. Think of it like a family with a whole lot of siblings, and each of them cause different kinds of issues, but certain types of them, certain family members are the big problem causers. And some of them will cause warts, both warts on the hands as well as genital warts. And some of the serotypes can go on and cause changes in the cervix in a female that can lead to cervical cancer. The reason we get pap smears, we have pap smears done, is really trying to screen for this early infection or later infection in efforts to prevent progression to cervical cancer. So the idea of a vaccine that, if preventing an infection helps prevent progression to cancer, is a complete logical construct that has seemed to bear out. And we're going to know this over this next generation. When we look at cervical cancer rates and are we starting to impact those, I'm pretty confident we will. Dr. Contractor brought up hepatitis B and giving that, we give that at very early ages. And that is a virus that can progress with infection to liver cancer. So both of these are, in a way, cancer-preventing vaccines, if you really want to take a look at why we're addressing that issue. They cause life-changing events. There's a cost to the individual as well as a cost to society to care for individuals who have these conditions. I hope that answers that question.
Mm-hmm. Absolutely.
So can everybody get the same vaccine, or certain people can't get the same vaccine for different reasons? Not everybody can get
So
an
depending
MMR
on
or
your
something?
age, gender, and medical conditions, different vaccines have different indications. And you can get dizzy very quickly trying to keep track of those things. And so you really do need to have a medical home that can help coordinate and identify when the right vaccine is given for the right time. With the HPV vaccine, I know Dr. Contractor talked about starting at 11, and that's just, and primarily focusing, early on we focused on females, but now we're doing males and females in that age group and trying to catch up later teens and even early 20s when it comes to that. There are other vaccines that are for different kind of infections that are for older individuals. So now we have a vaccine that helps prevent shingles. The varicella reactivation that occurs in many elders, and it's very painful, and the vaccine is very effective at preventing that recurrence, but we don't use that vaccine in younger individuals. There's a different varicella vaccine for the younger children that we use.
Right, and same with the tetanus booster. There are different ones for younger children just because of the response that they'll have to different components. It's still tetanus, diphtheria, and pertussis, but the different components are in different amounts that would make sense for an older child as opposed to a younger child. And as I mentioned before, there are folks who can't get the vaccine. So if you have an allergic reaction to any one of the components, then that would be a contraindication if you had an immune system deficiency. And that would be something that would be known to you, and you would discuss it with your healthcare provider. There are other situations where if you have a certain sort of immune deficiency, it's encouraged to get certain sorts of vaccines that are outside of the normal schedule because of your problems, such as children who have sickle cell disease. They'll get their meningitis vaccines from 2, as opposed to waiting until they're 11 because they're at higher risk. They'll get the pneumonia vaccine like adults would normally get. They'll get that at their, when they're once or 2, because of their risk of getting invasive pneumococcal disease. So there are certain things that are a little bit different if you have a certain medical condition, age, or like you said.
Yeah, sickle cell disease, folks who have,
even diabetes, there are different things that are indicated, asthma.
Immune compromised conditions, HIV, it changes the regimen and the frequency. And like I said, it can get very complex very quickly. But there are great resources for us to rely on that help us give the right vaccine to the right person at the right time.
So speaking of getting the right vaccines at the right time, we mentioned early on that August was Immunization Month. Looks like the Health Bureau is going to offer a clinic.
Absolutely.
So can you tell us a little bit about that?
August 27th, I believe it's from 8:30 to 4:30 at our site at 435 West Philadelphia. We're having a walk-in vaccine clinic. Now, when I say walk-in, what I really like to have is individuals contact the center earlier, bring vaccine records with them so we can identify and go through the process of getting the right vaccines to the right person, not duplicating efforts and not missing opportunities for vaccinations. But this, coupled with the other initiatives that are in the community right now, hopefully brings greater awareness to the importance of this very significant health need for our community.
So who is eligible to get these vaccines at the Health Bureau?
So the vaccines for the Health Bureau are for folks who are uninsured or underinsured, where their insurance would not cover the vaccines. So we're really targeting that community. Folks with insurance, we really want you to contact your primary care provider. They are the best guide in terms of identifying what your needs are for vaccines. We're always there as a resource to help with that. If there's a question from a primary care standpoint, we can help with education for even those offices if there's concern about what's needed.
And not that it's dangerous, for example, if someone were to get a vaccine a little early or a duplicate vaccine, there's no danger involved, but it's kind of a waste of resources. And if your child gets a vaccine a little bit too early, then you may have to repeat it to make sure you had a good response. So for that reason, it's very helpful to have your vaccine record ready, and if you already have your own provider, to just go there so that they have the most up-to-date records.
Okay. So where can people find additional information about the Health Bureau or the clinic that you're going to be having?
So with the Health Bureau, we have a website tied to the City Health Department. We're also on Facebook. We've been known to tweet once or twice as well, talking about these things. I know you have some organizations you're tied to that can also provide some resources.
The York and Adams County Immunization Coalition, and has a website, and a great website to get information from in general would be yourcdc.gov, as well as immunize.org. So, and then the Pennsylvania Immunization Coalition, so the PAIC has their website as well, and most of them have links to, the local things that are going on, as well as links to the most accurate, up-to-date and legitimate sources to get your information. So.
Well, thank you so much for all the information that you provided today. Did you want to add any parting comments about immunizations before we sign
Well, I mean,
off?
when it comes to information about immunizations, I would just say always consider the source. I have no problem with people surfing the internet trying to find information, but please bring that information to your primary care provider, to your healthcare professional who can help make sense of it with you. It's one thing to say there's an encyclopedia, it's another situation to take that information and organize it in a way that you can really make sense of it.
And then remember, flu season will be coming up soon, so definitely get your flu vaccine. If you have questions about it, definitely, like you said, ask your healthcare provider or find the right information. But flu is also a serious illness.
Okay. In addition, I would just like to say again, if you have information that you would like on immunizations, you can call the Health Bureau at 849-2299. You can schedule an appointment, ask questions of one of the nurses there. You can also follow us on Twitter at York City Health, and Facebook is York City Bureau of Health. Thank you, Dr. Contractor and Dr. Howie, Monica, for joining us today, and thank you all in the audience for watching.